Hey everyone, it's me, Dr. Whimsy, your favorite naturopathic doctor, answering all your questions about naturopathic medicine. And today I'm answering a really funny question that I was asked recently, and that is, I think the person was actually serious, are naturopathic doctors quacks? And the reason I decided to address this subject is because there's been a lot of backlash lately against naturopathic medicine and a lot of criticisms against naturopathy. And I really just want to briefly talk more in broad terms about the medicine I practice and my feelings about this whole idea of naturopathy as quackery. Like I said, I really want this to just be a general Q&A, and people can take it as they will. I think in general terms, there are good healthcare providers and there are not so good healthcare providers. That's true if you're a medical doctor, and that's true if you're a naturopathic doctor. So when I think about finding a healthcare provider for myself, there are things that I want and there are things that I don't want. The first thing I want is I want a healthcare provider that is educated, predominantly science-based, and compassionate. I also want a healthcare provider that's going to be able to take the time to listen to me and give me the medical attention I need. An example of a bad healthcare provider in the conventional medical model would be overprescribing addictive prescriptions. An example of that would be opioid addiction, which we currently are facing in the United States. Knowing that opioids are addictive. We've known that since before the opium wars. And yet, for minor aches and pains, people were in fact prescribing opioids, and it has led to not only economic ruin, people in prison, lives destroyed, families destroyed. I would definitely say that that is an example of bad medicine, and I would not say that it is science-based. A more naturopathic approach that I would take would be to find out the level of pain of the patient and see if we can't alleviate the pain in a way that's a little bit less invasive and certainly not addictive. For example, the patient, if the patient's in pain, they may be able to just simply ice the wound, right? Ice it if it's an acute injury. Or take something that is over-the-counter, a prescription is fine, an over-the-counter product that's not addictive to alleviate the pain, like ibuprofen, that we do prescribe over-the-counters occasionally, naturopathic doctors. But in naturopathic medicine, we really try not to go overboard. We try to treat a patient based on cause. So whatever the cause is, we try to remove the cause of what led to the illness in the first place, and to alleviate the pain and suffering with as minimally invasive procedures as possible. So an example of bad medicine, if you're looking at the conventional medical model, I think a top of the list would be overprescribing of medications, or the medical model that sees medicine for profit. The problem with seeing medicine for profit is that we don't necessarily see an extension of quality. We don't see a longer life expectancy. We don't necessarily see an improved quality of life. Even though they're spending less money on health care in Great Britain and even in Uganda, we don't necessarily see a longer life expectancy between the most money we're spending in the United States versus Uganda, which is something that should be really sobering. If a country is spending more money on medicine than any other country in the world, you would assume that we would have the longest life expectancy, but we do not. And again, that's because the American medical model is based on for-profit, whereas in a socialized medical system, the goal is to reduce cost. And so consequently, in those socialized countries, preventative medicine and research and studies, phase 1, phase 2 trials on herbal medicine, natural medicine, diet, and exercise, those studies are happening outside the United States because, again, the medical model is to reduce cost rather than to make profits. So that's an example of a conventional medical model where I think, that's not good quality medicine. Patients are complaining that they're not being listened to, they're not getting adequate help from their doctors, and they're only being given a drug rather than lifestyle, diet, nutrition choices, or minimally invasive procedures and treatments that are going to hopefully have less side effects. On the other side, I see criticisms against naturopathic medicine that is not science-based. Now, there's two schools of medicine within the naturopathic community. There's the classically trained naturopath, which grew out of the Victorian era and loves the more Victorian traditional forms of naturopathic medicine, homeopathy, etc. Then there's the more 21st century naturopathic doctor that really wants to see the science, wants to see the clinical studies, wants to see the phase 1, phase 2 trials. Again, they're usually coming out of Europe because that's where we're seeing most of the studies on preventative medicine. So this is something that a lot of people don't know, is that there's actually two schools of thought. I kind of fall into the middle category in the sense that I try to be science-based, I look at the data, I try to see what works, are there clinical studies, but I also look at folk tradition, what indigenous healers and what traditional healers have used, and whether or not anecdotally there was any benefit. I look at that, I honor that, and I consider it when I develop a treatment plan for my patient. I also sometimes like a little bit of the more esoteric treatments. I don't rely on them. They're not the primary way that I treat a patient when a patient's coming into the office. An example would be offering a massage. I am a licensed massage practitioner. I did those studies before I went to medical school. And sometimes I think patients do need touch, they need massage, they need compassion, and certainly they can come and get those types of more holistic treatments at my offices. Aromatherapy, I would say a lot of people think that that's a little bit woo-woo, but I certainly use it when I offer massage. And if my patient is more relaxed, if they have less stress, if they have less anxiety, if they are more at peace as a result of receiving those treatments, if the blood pressure drops, if they're sleeping better at night, if they feel safer in their world because they've received a treatment like that, then in my opinion, and I think there's some science to back it up, that it was a successful treatment, even though it may not be a conventional treatment. All right, so that's basically my opinion. I think it really has to do with the healthcare provider, whether or not they're quack. I would also say that a good healthcare provider knows their limits. Doesn't matter what kind of healthcare provider they are, whether it's a naturopath or it's an oncologist or a cardiologist. We know what we're good at. We focus on developing and mastering the area of medicine that we are good at, and when we have a patient that we cannot help or is beyond the scope of our training, we are humble enough to refer that patient out where they can receive the medical care that they need. And so another last thing I would add is that whoever you choose as a healthcare provider must be someone that knows the scope of their training and is willing to admit to something being beyond their scope. We see that a lot within the hospital setting, where a team of people will work with a patient. Everybody is compartmentalized, they have their own little area of medicine, and everybody is focusing only on their one study. I'm a little bit more integrated than that, but certainly I recognize the limitations of of preventative medicine, and that there is certainly a place for more invasive medicine, internal medicine, cardiology. That's the primary care physician. I try not to step on her toes, but I also feel that the preventative medicine and the use of natural medicine to assist the primary care physician can go a long way. All right, I want to thank you for watching this quick video. My name is Dr. Whimsy Anderson. If you have any questions about naturopathy and preventative medicine, please reach out to me. I love answering your questions, and thanks for watching. Bye.